I know that in 6 months when it's hot and humid and we're all sweaty and wearing shorts and tank tops, I'm going to miss this weather. I never complain in the summer. I love the winter in northern United States. So anyway, our patient today is also one of my favorites. He's been a very long time patient. I met him first when he was helping interpret for some Russian patients. But he is also a surgeon, and he was a surgeon in Russia. And as you'll hear him say, he did a fellowship and got his license here. I'm not sure how long he practiced, but he's a wonderful guy. And you'll hear us talk about how some of the medicine in the U.S. is like being in a third world country at times. So tell us your comments below and enjoy the video.
Hold urine after they put 50 cc's of chemical for 2 hours. Well, at least, they want you to keep at least for 1 hour.
Mm-hmm.
I kept for 5 minutes. I couldn't.
Well, and of course, when they tell you you can't urinate, that's all you can think about is I gotta pee.
I didn't even think, it just started to come out.
Oh.
I pee, my pants, everything.
Oh.
I didn't expect it. And so there was a first treatment. Second one was the same, and I informed my urologist that it's a waste of my time, it's a waste of money for insurance company. They pay for something that has no any effect on me.
Mm-hmm.
Period.
Yeah.
Still, they send me for a third one with the kind of hope that I will hold it. So every time it was about 5 minutes.
Oh.
So naturally, I left without treatment. To make things even more strange, you told me about shortage of lidocaine or
Right.
whatever. I was seeing my primary provider this morning
Okay.
at the West Health. It's a diabetes checkup. So he sent me to, after appointment, he sent me to lab for A1C and also for lipids profile.
Mm-hmm.
And there was, about, this size of a picture, notice for patients saying that there is a shortage of butterfly needles
Right. We can't get any.
and the tubes
Mhm.
that, they collect blood
Right.
in the United States. I said, Jesus Christ.
Yeah. It feels like we live in a third world country these days.
Yes, you're absolutely right.
We can't get the tubes for blood draws. We finally got some lidocaine after a year. Or any local anesthetic. You couldn't get any kind of local anesthetic it took us almost a year till we got some. So were they not able to draw your blood then?
No, they did. Well, they use, straight needle.
Right.
No problem. I have very good veins, so, I don't really, care which needle they use.
Right.
I don't. But some people, they have awful, veins or own veins by, maybe same, like a chemotherapy,
Right.
long term. No, I didn't, she used 3 tubes,
Mm-hmm.
so didn't have any, problems. But some other people, they, might have very serious and even life-threatening, problems. If you can't collect blood and you don't know what's going on inside of a patient, it's awful.
It is. We haven't been able to do blood draws here for a while because we'll order a case of the tubes to collect the blood, and they'll send us 1 tube. Well, what are we going to do with 1 tube? It's been a very frustrating couple of years with all the shortages of medications and like our local anesthetic. I mean, there are people I can't even trim a toenail without numbing a toe.
I don't understand why this happens in United States.
Well, because we get these products from outside the United States. I don't know, half of me feels like they're artificially created shortages so that when they come bring it back, we're so happy that we have it again that we're willing to pay more for it. That's half of me thinks that.
My wife read an article about BCG vaccine and shortages.
Yeah.
And the article said that Merck company that has patent and the only one company that licensed to manufacture BCG vaccine for intravesical use, they manufacture for entire North America, Canada, United States, and Mexico, plus 17 other countries.
They're the only provider, the only.
Why, we have to worry about other countries when we have a shortage in our own country?
I know, it's, yeah. Okay. Just want to stop and show one thing here.
That's you did.
The nail removal. So people ask, what does it look like years down the road? And this is what it looks like. It's just a nice straight edge. And you would never know unless you're looking super close. That's it.
Situation that we face in the United States nowadays with some drugs, with needles, reminds me of what happened back in the 70s. We've been living in the United States for probably a couple of years already, and I landed a job and fellowship at Metropolitan Medical Center surgery. My sister-in-law in Leningrad, she needs to have hysterectomy because of multiple fibromas in the uterus, but she would not be admitted to the hospital until she brings with her suturing material, because they didn't have any sutures
Oh my God.
for surgery. So, but in Russia, it's not like United States. You can, buy it, somewhere. Well, I can put.
No, I'll do your socks.
And you can't, get anywhere. So I've been collecting opened but not used suturing material here. Sometimes, they open but surgeon doesn't use.
Right.
So they, throw away.
They can
So
re-sterilize it.
Yeah, I collect them, I pack them, sterilize them, and I send to Russia. And she had a surgery
Wow.
with American purlin, American catgut, American tepduck, or name it, whatever.
Well, thank you for
See-
letting us do the video.
Oh, my pleasure.